I'm very proud of the nurses at the bedside because they're natural leaders. They truly embody experienced care, expert caring, which is our mission statement for nursing, and they have truly exemplified that by delivering the best care they can amidst their own fears and concerns. Leadership can be embodied in different forms, and what I've seen true leadership, especially during the time of the pandemic, our true leaders have displayed creative thinking, resiliency, and perseverance amidst all of the challenges that they have faced, and they truly did not crack under pressure. So what I see amidst all of this is the silver lining. So the struggles we currently are facing right now builds our strength for the challenges we face tomorrow. We have seen struggles at the bedside with the staffing shortages, and we've lost some of our peers as well to the illness. And despite all this, they have to show up to work on a daily basis, be the best that they can be for their patients. They have to show courage, they have to promote hope to their patients as well as their families. And I think it speaks to true leadership because they are not afraid being dealt with a lot of pressures at the bedside, but still they continue to persevere.
Wellness for us in the ADTU, I think it's really it's just a culture and a mindset. I think as a nurse, we're always sort of promoting wellness for our patients in one way or the other. Nurses see patients very holistically. Nurses will kind of see the whole picture, and they'll also deal with the patient's emotional wellness as well. They have a good feel of how the patient feels, and so we try to help the patient just feel better a lot of time, and that could be through a meal or through cheering them up or just being there for them and listening to them.
Innovation to me as a nurse is critically looking at our patient care pathways and processes and how we can improve them and coming up with novel ideas to make them better for our patients. Our stroke team is constantly looking at our processes and our pathways and how we can improve the delivery of patient care so we can improve stroke outcomes and the survivorship of stroke. We've been innovative in several different ways. One example is roaming education. So the stroke coordinators actually brought coffee to 13 different inpatient units to give them direct stroke education to the bedside nurses. We've also partnered with our EMS colleagues in changing their processes and protocols and identifying stroke patients in the field and delivering interventions more timely. Being innovative as a nurse is important so that we improve our patient processes and, more importantly, their outcomes. UF Health nurses are wonderful at this because they don't take the status quo and are constantly looking for ways to improve our patient care. We're at the heart of the healthcare, and we want to improve our patients so we can send them home.
I think for me, solidarity is a deep rooted connection that you have with not only the nursing profession, but it's a connection that you have with all nurses. It's not an empathy, but more of a respect and dignity. It's an empowerment that drives our profession. Nursing in general, and my team included, solidarity, I think, for us is best demonstrated through teamwork and engagement. Nurses, we have to be involved in decisions that not only impact our work, but impact our overall practice. We do have to support each other. And I think that especially through COVID, we saw a deep need for teamwork, and I think that it greatly impacted our nursing staff. They were challenged greatly, but I think that one of the good things that did come from it is the team dynamics are so much different post-COVID. The team is strong. They rely heavily on each other. They support each other, not only emotionally, but physically. It's that strength and teamwork that exemplifies solidarity in its finest.